Hi, I'm Vanessa Fowler, and I'm a patient care advocate here in Kelowna, BC. And I am creating this video today because I feel that I need to answer a lot of frequently asked questions I get when I'm talking about my company. A lot of people don't understand what a patient care advocate is or what they do for you. So I'm going to design this video in a sense of question and answer type of format. A little bit about myself. I'm a registered nurse. I specialize in emergency care and I've been nursing for about 13 years. The reason I decided to do advocacy is because I found it's kind of one of my niches to be able to work with patients to make sure that they are educated and they can make informed decisions and help give them the courage to speak their voice. So my business is called Nightingale Patient Care Advocacy. And the first question I have here is, what is an advocate? I basically tell everyone that we actually all come across advocates throughout our life. The most common advocate that we're very familiar with is a lawyer. Most of us don't know the legal system inside and out. So if we ever come across a point where we have to go to court, or we're being charged with something, or maybe we are going through family court, going through divorce, we hire a lawyer because we don't know the ins and outs of the legal system. Not enough that we can feel confident walking into a courtroom and be able to represent ourselves. So another type of advocate is a social worker. A social worker is an advocate for children and families. We all have probably a good general sense of what a social worker can do for a child who is endangered, and we rely on them to be able to navigate through that system to empower that child to be able to live a safe life. So when you look at a patient care advocate, it's our healthcare system that sometimes gets so complex, or maybe you're feeling like you're slipping through the cracks, or you're not being heard, or maybe you're just confused about what it is that you need and you don't know all the available tools and resources that are out there for you. This is where an advocate can come into play. So an advocate basically is someone who's going to help speak your voice or give you that courage to speak your voice, to become an active role in your own healthcare. So who hires an advocate? Now, with my company, I've been hired from all ages, people that are younger than me or who are like elderly in their 90s. So it depends on what it is and where you're at with your healthcare. Sometimes people are diagnosed with something that they're overwhelmed with. They don't quite understand their options. Maybe they have been given or appointed the job of taking care of a loved one. Maybe your mom has become so frail, elderly, maybe she's got Alzheimer's, and you have been appointed to make those decisions for her, but you're overwhelmed. You don't know what's out there for you. That is where basically I come into play, or any other advocate, is that we've been trained as healthcare professionals to know the ins and outs of the available healthcare system for you. We can take the time to educate you with all the resources that are available in your community. We can help do some research on alternative healthcare solutions and just give you all the straight facts so that you yourself can make an informed decision and moving forward. So who makes a good advocate? What I tell patients is my goal is to help you become a good advocate for yourself. I want you to be able to feel confident enough in researching, asking those right questions, knowing that you have a right. And it's okay to ask questions. It's okay to just, keep digging with your doctor until you can walk out of that office feeling a bit more at ease that you have made the right choices, that your doctor's listening to you. Now, some people, and I know, do hire me because they don't have that confidence. So they will hire me to come with them to an appointment to ask the right questions, or just basically be there to listen to the doctor, so that when they go home with me, not with me, but with them, I can spend that extra time to make sure that they fully understand what's going on. I'm sure we've all been there, where you go to a specialist appointment and they've just given you all this information. They've just diagnosed you with something and they're telling you all your choices, and they say, you go home, you decide, we'll talk to you soon. And you think you got it, and you go back home and you got all your family members asking, well, what did they say? Well, I think I had a heart problem, and he said my heart was skipping beats or something. Well, what does that mean? Sometimes when you go home and after you've had a chance to process, you realize you maybe didn't understand as much as you thought you did. So this is where an advocate can come into play. They can come to that appointment with you. They can take notes. They have a medical background, and you can ask those questions. They can spend that time with you, because sometimes you're just not grasping it at that moment. Okay, so what can an advocate do for me? There are quite a few things an advocate can do. So they can come to appointments with you. Maybe they meet up with you before your doctor's appointment, and they can actually go through some question and answer period to figure out what you're going to the doctor for. Because you have such a limited time with your doctor, you need to make those minutes count, because your doctor really wants to help you. They are there. This is why they become a doctor. But they do rely a lot on what it is that you tell them. And sometimes people have a hard time communicating that. Another option for an advocate, maybe you're trying to mediate with family to figure out what to do with mom and dad. Maybe you all have been put in charge of what the next steps are to do, and you all have different ideas of that. An advocate can come in there and be a mediator and help lay out all the options for you. Make sure that you are tapped into the right resources so that you can actually make an informed decision. Another option for a patient care advocate is helping you create a medical binder for yourself, so that when you go to the specialist or to a doctor, you have all the pertinent information in a condensed version. I have a lot of patients who show up into the Emerge with binders or big boxes full of all their medical records. And unfortunately, there's not enough time, especially in an emergency care situation, to be able to go through all that important information. So a medical or a patient care advocate can help you put together precise details that are pertinent to that patient's care or your own care. And it just makes everything move a little bit smoothly. You can get more out of your healthcare system at that point. Another thing that I've come across as a patient care advocate is some patients feel that I can make a decision for them, or can I go on their behalf? And the answer is I cannot. I cannot give medical advice. Only doctors can give medical advice. I'm a registered nurse. But what I can do for you is make sure that you can make an informed decision by educating you with all the options. I can't go to an appointment for you, and neither can any other advocate. Your healthcare providers rely on you being there to basically assess you and ask you the appropriate questions and give you the right treatment. Another question I get is there a fee to patient care advocacy? For my services, there is a fee. Now, some hospitals do have advocates on site. They might not be called an advocate. They might be called a nurse liaison. They might be called patient care quality office. There's all these different types of terms. So it depends on the facility that you're working with. They usually have some type of person who is the liaison, the person who's going to work with everybody and kind of tie everybody together. Now, some patients don't feel that that is enough, and they would rather also have someone who's nonpartisan, not part of that organization, who can work with them, that they can hire, who is working directly for them only. Now, prices vary. It depends basically on the qualifications of your advocate, whether it's a social worker, an LPN, a registered nurse, or a doctor. So you would have to research the company that you're looking at to ask for those specific fees. So do you have to use your advocate all the time? Absolutely not. You can use an advocate as much as you need them or as little as you need them. Again, my goal when I work with my clients is to educate them to the point where they feel confident enough to be able to do a lot of this stuff on their own. Because I think once people are educated and get to that level, they realize that they actually have a lot more say and they can do a lot more than they maybe think. But with that being said, I can do any level of advocacy for you, as well as any of my staff. So you get to hire us as much as you want. You can cancel it at any time. Basically, we're there when you need us. Can you be taught how to be an advocate? Absolutely. Any of us can be an advocate for ourselves or for somebody else. I have created a program that it's a basic ABCs on how to be an advocate in your own healthcare. So that is one option. We all, again, even as a registered nurse, there's always a point where somebody's going to know a little bit more than what you do. And if you ever get stuck, sometimes you end up hiring someone else. But I do know that most people can be educated enough to be able to navigate our healthcare system. And that is our goal. But what is the process if you do want to hire an advocate? Because there are going to be times where you might feel overwhelmed or you're not going to be capable. Maybe you're not available to be an advocate either for yourself or someone else. I suggest going into Google, just researching in your community to see if there's an advocate. I myself serve the Kelowna and Okanagan area. And what I do is I meet up with the patient and we do a patient care intake form. It just gives me a little snapshot and it's totally free. We spend about 30 minutes just kind of getting a snapshot view of where your circumstances are and how it is that I might be able to help you. And at that point, you make a decision if you want to hire me and we can move forward. Now, every company's got their own process, but generally speaking, most of them do a consultation and then you make a decision at that point if you feel this advocate can help you. Now, it's important to also ask your advocate their educational background because depending on what it is that you need, you might be searching an advocate that is more specialized in that avenue. Hopefully, I was able to answer enough questions here to give you a good sense of what a patient care advocate is, what they can do for you, and give you that extra option to be able to hire someone to help you navigate our healthcare system and help you gain more control in your own healthcare. Have a good day. From Nightingale Patient Care Advocacy. Take care. Bye-bye.